Welcome to 10 Health. Today our topic is the Lancaster County Community Mental Health Center. I'm Gwen Thorpe. I'm joined today by Ron Sorenson, Deb Shore, and Dean Settle. We are in the process of making a change to how community mental health services are delivered in this community. And today with me to discuss kind of the process and where we are these three folks who've been involved and will continue to be involved. I'd like to start by asking Deb Shore, who's the chair of the Lancaster County Board of Commissioners, kind of to give some background, how we got to where we are, and what are our next steps. So Deb, would you like to
Well, it's
explain?
a pleasure to be here and to have the opportunity to talk about the process that's occurring at the Community Mental Health Center. I think it speaks to the fact that the board wants to be very transparent in what we're doing and taking every opportunity to share news with our constituents and our consumers. For several years, Lancaster County Board has endured some pretty severe budget cuts. And over the years, we've looked at mandated services, which are the ones that we are required to fund under state statute, and those that are non-mandated. And there are some services at the Community Mental Health Center that are mandated, such as the Crisis Center. And then there are some that are maybe a little bit more subjective in the funding. And over the years, we have continued to cut the funding to the Community Mental Health Center because of the budget issues that we've had. And so rather than continuing to see it kind of hacked away, we began to look at the possibility of providing services to those consumers in a different way, and increase partnership with other entities in this community. So it was something that the board began to look at, and then there were these other kind of factors that came into play. There was an increased emphasis on the national level of providing behavioral health services in conjunction with primary care. So that was kind of one initiative that was beginning in this community. The fact that we were opening a new corrections facility, and we're going to have new space available on this campus here between 9th and 10th Streets. So we were looking at reutilization of spaces for local governments. So that factor came into play as well as the Community Health Endowment undertook an initiative with a national consulting firm to look at the safety net in this community. So, you know, it was all of those four factors that came together that caused the county board to kind of stop and step back and look at the big picture and look long term as to how we provide behavioral health services in this community, because we know how important they are to our consumers. So we wanted to make sure that we had the right people at the table, that the stakeholders, the funders, the consumers, and to look long term as how to provide those services.
Very nice synopsis of where we are. And one of the things I'd like us to discuss now a little bit, and you're sort of at the helping put together a communications plan so that everybody, consumers, families, employees, and the community have an idea about what's happening.
Right, and I know Dean will be talking about the task force that we appointed, what's been about 9 months ago?
Done in June
Done in
last year.
June, so we're getting pretty close to a year. So, but one of the things that came out of that task force was the importance of keeping our employees, our consumers, as well as family members up to date as what the board is discussing. And in addition to our Tuesday meetings being televised, the opportunity to do this today on Channel 10, that'll also be available on Channel 5. We have a letter that's going out to all county employees as well as those consumers and family members to provide a kind of a written update. And I think that we are trying to use every single opportunity. The web will have active links on the city's website, the county's website, as well as the Community Mental Health Center website. So using all types of media, maybe we can have Dean start using Twitter or something too, but making sure that we're using every single platform we can to keep people up to date.
I think that's important, that the board is dedicated and committed to making sure that news about the process is easily available to those who are interested in knowing what's happening. I'd like to introduce now Dean Settle, who's the current Executive Director at the Community Mental Health Center. Dean, how many years have you been there?
Almost 14.
Almost 14. And Dean is getting ready to retire and has been an integral part of this process. And I'd like you, Dean, to explain this task force, what their charge was, how they reached out to people, and those kinds of things about the task force.
A little bit of additional baseline too. We serve 5,000 adults in Lancaster County. The Community Mental Health Center, as it now functions, is 36 years old. So it's probably a really opportune time to step back, look at the mission, look at some of the new best practices that are out there in the United States, and see what we can do to maybe reinvent better, comprehensive, more accessible services. Deb had already alluded to the idea of integrated care. That makes eminent sense at this point. The other one I think that we'll see coming more and more into play would be more consumers involved at all levels. People who have gone through our services are now stable and really want to give back and help maintain not only their own wellness, but improve the wellness of others that walk in our door every day. So we see some real opportunities. We also see possibly a change in governance. Rather than being a publicly funded and operated and controlled agency within county government, probably one of the outcomes would be that we would shift to the not-for-profit sector, possibly. And so it'll change somewhat. Programmatically, probably not that much. Staff may get a different paycheck from a different employer, but the services are going to remain. Nothing is going to close. Right. People need to know that those services that you rely on today are going to be there for you tomorrow. Okay. So that's really important. The result of the county board looking at this very critically and doing some visioning of their own forced, I think, a juncture, fork in the road, if you will, and that was last May, June timeframe. The board said, let's get a transition planning committee appointed, and that was done. We ended up with a 7-person panel from various stakeholders in the community. We met 11 times formally. As a result of that planning initiative, there were focus groups throughout the community for people that we serve, for families, for guardians, for colleagues, for providers, for lots of neighborhood people that we live with down in the Near South neighborhood. The main building is at 17th and South Streets. And it's right in front of Bryan LGH West, so it's got an opportunity to even build more on that neighborhood and even do more possibly with the hospital relationship in the future. So there's a lot of positive things happening. We then probably touched approximately 800 people through focus groups. They would come, they would meet, they would answer a preset ordered list of questions, and we really distilled down, I think, some things that are very important. The services are very needed in this community. It's an essential part of the good life in Lincoln, Nebraska. Without the mental health services, this would be a different place. So we want to make sure that those are available and they're accessible and they continue on at the same level of quality. We also found out that a specific location is extremely important, and that 16th and South focal point is something you'll hear about in future shows and in future talks that we have. We made the recommendation after pulling all of that input together, looking for best practice opportunities. We made the recommendation to the board, I think early January, and the board has adopted the paper, and the recommendations are contained in it. They're available. That report is available, correct?
Yes,
Gwen?
that is available.
So viewers can jump online and actually download
We'll
the
make
report.
sure that it's there.
All
Yes.
right. And so that's kind of the background on the panel. I felt really good about it because lots of people participated.
Right.
Everyone had an opinion, and we listened to those opinions. And I think we learned a lot as well.
Yes. Thanks, Dean. I know the board is very dedicated and committed to making sure that adequate and the correct services are available in the community. We realize that that is very important to the community. So appreciate that update on the panel. We will take a quick break and come back and talk with Ron Sorenson, who will be the interim executive director at the Community Mental Health Center after Dean retires. So please join us in a minute. Welcome back. Again, we're talking about the Lancaster County Community Mental Health Center. We have discussed a little bit about how we got to where we are and the task force process. Now, Deb, what lies ahead?
Well, one of the recommendations that came out of the task force was for Lancaster County to partner with Region 5 systems throughout this transition time. And Region 5 is a kind of quasi-governmental entity that represents 16 counties in southwestern Nebraska and is charged with providing behavioral health services and substance abuse services as well. So it is really a time for us to partner with their expertise over the next 18 to 24 months. And that's how we came to include Mr. Ron Sorenson in this transition process, and who will be appointed next week as our interim executive director, and are pleased to bring his decades of experience in the behavioral health field to Lancaster County. So I'd like to hear a little bit more about your history and your expertise.
Thank you, Deb. Excuse me. I spent the last almost 20 years in behavioral health. I joined the State Department of, or Division of Behavioral Health with the state in 1995. And in that period, I worked there until 4 years ago. And during that time, we went through significant changes in the behavioral health system. For those people that were around the system at that time, they know we went from kind of a hidden, obscure system to one with a lot of high profile as a result of behavioral health reform in 2004. And one of my roles was to participate in behavioral health reform, to work with regions, providers, consumers across the state to help redesign the system and design what services we would put in place. I became the director of that division in 2005. And in that process, we had a large number of successes, I think, in that transition to moving people from regional centers, the state's regional centers or mental health hospitals, back in the community. And this kind of process is not unlike that. It's again, we're going through another whole sort of reform. If you look at federal legislation, you'll look at the economy and what the county's going through now with the problems with revenues and so on. What you've got is a situation where we need to look at the system and make sure that it works effectively. And so in my experience with the region, I've had the advantage of learning more about providers, learning more about the mental health center. And so I think both at the state and at the regional level, I've managed to get some background in just how the system works and what things we need to do to move forward. I think critical to this is, as both Deb and Dean have explained, is that we've got to involve the consumers in that process. We have to involve the employees in that process, because they really can give us the best information about what the system looks like and what we need to do to make it better. It's really an opportunity. It's a very difficult time that we have to get through, but it's a real opportunity to make things better. And I think I can help in that process because I've been involved in those kinds of activities. So.
It is a big job, and there is a lot. A change like this brings a lot of uncertainty. And that is one of the reasons we want to do this show, and we will do additional shows as additional information is available and the timing is right. We will make sure that we get information out to the consumers, the staff, family members, advocates, providers, so that everybody's aware of what the board is doing. I know that the board intends to continue gathering input from those involved in the whole system.
And Gwen, we will be talking about this every Thursday at our staff meetings, which are right here in the City County building in room 113. You can check on the website to find the exact time, but it's every Thursday morning, and it's a commitment that the board has made to continue to discuss and take the next steps every single week, because part of it, the uncertainty and unease with regards to staff and our consumers is not knowing what lies ahead. So as we talk and develop the process, we want to make sure that they're kept informed as to what's going on. So I invite them to attend and to utilize, the website to gather information as well.
We will have on the county's website, which will be rolling across the screen here in a minute, we'll have updates, we'll have a link to this show. It will be available on 10 Health YouTube as well. We will have articles in the newspaper. Just every opportunity that we have to communicate will be taken. And we expect and hope that people with questions and concerns will email the commissioners at commish@lancaster.ne.gov or call the phone number, which will be on the screen, 402-441-7447. And we will be happy to provide information that we can, because we want people to be informed and not worry that if they think something needs to be addressed that they haven't seen yet. And so we invite contact from people at any time. Are there any final comments any of you would like to make?
I look forward to continued contact through this medium. I can tell you, sitting in my chair each day, I get phone calls, and it's usually misinformation that someone has heard or someone wants to check it out. And so I would encourage the viewers to look to this as a source of bona fide, honest to goodness information that policymakers have hammered out. And I think that's what people need to understand and seek for their informational purposes.
Yes.
And Gwen, if my closing thought is to thank Dean for his many years of outstanding service to Lancaster County in this field, and his willingness to come back even after he had officially retired the first time and assist us for some additional months really shows his commitment to his staff and to the consumers. And we just really have been blessed with his expertise and his dedication, and Lancaster County certainly is better because of his service.
Thank you very much.
I think
it's a good mission, and the people we serve are indeed some of the most needy in the community, but they can also be very productive with some excellent supports, and that's what our business is all about.
Right, right. Well, I thank you all for being here. We look forward to more of these. And again, please contact the County Board office if you have any questions or concerns. Thanks for watching.